committee meeting to order. Madam Clerk, can we do roll call, please?
Ron Buckles,
Present.
Ed Peters,
Present.
Jason Weaver, Mark Helwig,
Yes.
Marshall Savitsky. You have a quorum.
Okay, all right, let's do the pledge of allegiance.
To the flag of the United States of America and to the republic for which it stands, one nation,
Okay, certification of compliance with the open meetings law.
This meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin statutes.
Okay. Meeting agenda has been presented. Is everybody okay with the way it is? Okay, and then we're gonna move on. Public comment. We don't have anybody out there that wants to speak publicly, do we? Okay. All right, number 7. Consider approval of minutes from the previous meeting.
Take a motion to approve.
Okay. We have a motion by Mr. Helwig and a second by Mr. Peters to approve the public safety minutes of the previous meeting. All in favor, say aye. Want to use this thing?
No, for this one, it's so quick, we can do it.
Oh,
the old
aye,
fashioned way.
okay. All opposed, motion carries. All right, number 8, judge's report. We had an email from the judge. He's out of town or something. He's at a conference, okay. Number B. Courthouse remodel update, Mr. Alvarado.
Nothing really noteworthy to report since last month. You can see it's taking shape out there. The east entrance is, you're seeing all the boardroom is getting encased now, and timing wise, they'll be here next few, today, tomorrow, or early next week to do the blacktopping, which will affect the sheriff's parking lot. So that just came in this morning. In that little bit of blacktop work done, they're not going to be blacktopping the east parking lot. That was in the schedule to be done before winter. That's not going to happen until spring now. But other than that, I did a walkthrough with Tim and the project superintendent last week, just to look at how things were shaping up, and then we'll be putting some stain on the concrete in some of those rooms. So we took a look at that. I think everything seems to be moving along smoothly.
Good, good. Anybody have any questions for Andy on that? Okay. Number 9, clerk of courts report. Marge?
Nothing to add other than our newest clerk, Christy Kerr, our civil small claims clerk, started with us on Tuesday. And she's currently in the training process. K-A-R-E.
Okay.
SCH.
K-R-I-S-T-I.
All right. Anybody got any questions for Marge on her report? None? Okay, thanks, Marge. District Attorney's Office, nothing. Number 11, Sheriff's Department report, Communication Center report.
Mr. Chair, I would just like to start off by, for those that are not aware, on October 26th, just after 4 o'clock, Craig Falstick passed away after 36 years of law enforcement service, his last 4 years as chief deputy. 2 days ago, on November 1st, Rick Chambers, our retired chief deputy, passed away after over 30 years. Craig fought pancreatic cancer for 1.5 years. Rick Chambers fought pancreatic cancer or prostate cancer, bone cancer for 13 years.
Wow.
Both of them served well, did a lot for our community, and were excellent leaders. With that, I would sure appreciate a couple minutes of.
Exactly, you got it. All right. Okay, thank you. Thank you, Sheriff. Any more?
No. Outside of the fact, proud to introduce our new lieutenant, Lieutenant Weller with the jail. And he will later give, the jail.
Jail report, what, breaking man. Welcome, and congratulations. All right, number B, patrol report. Huh? Did I miss you? Oh, community. Well, you're so quiet back there, chief. Yeah, go ahead, sorry.
So, dispatch center is still, we still have one full-time vacancy. We do have, two individuals in training. One of that trainees will be in their second phase and starting sitting second as the second dispatcher, so she's moving along. With the upcoming holidays and hunting season, there's a lot of vacancies in dispatch, so a lot of the dispatchers are doing a lot of overtime, and frankly, I think some of them are getting tired of the overtime. So, we'll be meeting one more time with Mac Tech, to get that third station recorded. It sounds like it'd be an expensive, there's an expensive part of the project and a cheaper way to go with the project. So we're leaning towards the cheaper way to go with the project, to be about $4 or $5 grand to get that third dispatch station recorded. And Corey also applied for a grant from Enbridge to purchase a new drone for the sheriff's department. So we haven't heard back on that yet. Calls for service in October are down a little bit from October of last year, and same for the total calls for service for year to date. So far, we're at 15,024 calls for service.
Okay. Do we have does the sheriff's department have a drone at all?
We do have a drone.
Oh, you
Three of
do?
them.
3 of them?
We have
Okay.
1 drone, 3 operators.
They have that little drone too.
Oh, the little mini drone. Used to.
Okay, all right. Any questions for the chief deputy?
I guess I just, one thing with regard to, trespass. Since that's seems to be, an issue in Palmer's River. But I just was wondering whether or not those were spread out over the county. What's the distribution of those calls for trespass?
I'd have to find out for sure, but I do know that several of them were down over in the Great Area and they were related to hunting.
Okay.
We also had one trespass issue that was related to more of a family issue.
Okay.
So.
Thank you.
Thanks for asking.
You don't want gunsmoke. This guy thought that if they came on the property, anybody came on the property, they could shoot them.
Well, that's on TV and.
Okay, any more questions for the chief? What was that, Sheriff?
That's in Kansas.
Oh, it's Kansas, yeah. All right, if not, we'll move on to number B, patrol report, Lieutenant.
Thank you, Mr. Chairman. Patrol call volume did decrease again, 724, which was a decrease from this time last year. We were at about 762. A lot of the calls were centered around more involved calls, drug-related interdiction calls, and we didn't have a high number of traffic interdictions, so traffic stops were slightly down. Overall, our deputies have issued 38 citations for traffic offenses, 1 written warning, and 34 non-traffic citations. Again, school's in session, so we expect to see that to be continuous. And many of those are from our truant deputies. Community mass, we had 15 total crashes for the reported period, 3 with personal injury and 0 additional fatalities, bringing our totals for the year to 245 for crashes, 74 personal injuries, and still maintaining 2 fatalities. Want to comment that we did recently assist the Stone Lake Cranberry Festival on Saturday. The weather was very pleasant and drew an expected large crowd. We're planning next week with our first meeting with the American Bird Finder and planning for the 2023 event. And our deputies recently, our patrol deputies and staff recently received a tactical med training in cooperation with Sawyer County EMS. And as a result, we'll be purchasing 20 individual first aid kits to be issued to our staff, our road staff, and it's more than just putting a Band-Aid, that we're talking, chest wounds, cavities, wound ballistics, that type of stuff.
Hmm.
So,
Good. Okay. Is that it, Lieutenant?
that's all.
Any questions for Lieutenant Rapinski? Okay, not, thank you. All right, number C, jail report.
Thank you. The month of October, our average population was down approximately 80 inmates. We're floating right around the 20 inmates or 20 female inmates to 60 males. Average probation incarceration is floating around 10. Pre-sentence incarceration 57-ish with roughly 12 to 13 average sentence inmates. We currently have 19 females housed in Barron County and 3 out on electronic monitoring. And that's all we got.
Okay. All right, any questions? For him? Not? All right, thank you. All right, number D, update on the use of electronic bracelets. This come up in our, not our public safety, but admin committee. On use of these bracelets. Is there, Sheriff, who mandates who gets a bracelet?
Ultimately, it's in my court as sheriff. And we're working with Justice Point. As far as the criteria, we have based it in the past on Huber. And we have not had much for Huber privilege inmates, so that has changed a lot of it. We want to set it up so that it's successful as far as for the inmate and also to keep the community safe as well.
So I guess one of my questions would be, our female inmates that are housed out of county, is there any of these females that could be put on them bracelets?
Yeah, we have 3 on bracelet right now.
So that would save some money from, is there like any more that from there could be on them?
That we've had that discussion, and I don't have the data there as
Okay.
far as criteria data on what it takes to meet that. But
Okay,
we have had some discussions with Becky Berry as well with Justice Point on meeting that criteria.
yeah, because I think, some of like these females, if we could get them into the criteria where they're eligible for these bracelets, that would save the county some money from out of town placement.
Yes.
So, yeah, okay, thank you for looking into that and keep us posted on that, would you please?
Well, we can give a more detailed presentation next month.
Okay, all right, good.
Sheriff, is that different than the monitor?
Bracelet the same as the monitor.
The electronic monitor, the bracelet's the same, yes.
You have to keep in mind that the majority of the females that are down in Barron are pre-sentenced inmates. They're
Oh.
not sentenced inmates.
Oh, they're precincts, okay.
And we can't do that on the pre-sentence. It has to be
Oh.
post-sentence. So that's, and the judge has to, grant Huber privileges by the criteria currently
Okay,
on the post-sentence. So what are we, 50% pre-sentence in our jail population?
Holy crap.
wow,
Almost 60.
Almost 60% pre-sentence. So that's the big shift
Shift.
of why, because I have no say in that on the pre-sentence.
sure, okay.
Once you tie it to them.
Yeah, wow, all right, that's good, just keep us updated, Sheriff. All right, number E, tribal enforcement grant. Discussion and possible action. Who wants to take that?
I have not had any updates. I mean, the sheriff's department let the state know that we wanted the grant dollars to stay in the county, that they were trying to work out. We had the county had told the LCO tribe that we were fine with them taking the grant directly. I think they're still talking to the state about how to have that happen, though. That's last I heard.
I did have, a meeting with, Schlender in the hallway and passing, and they're working.
So we want to postpone this one again until next month?
Yeah, I don't have anything else to.
All right, okay.
I think the end of the month is the deadline for it, so we should know where it's at by next month.
So how's that gonna work then?
We can tell you more next month.
I think on our side, Sheriff, correct me if I'm wrong, we prefer that the state just grant dollars directly to the LCO.
Correct.
Take us out of the equation.
And in talking to Jim, on several occasions, that's their intent, or my perception of their intent, by what he's indicated to me, that they're gonna work on it directly and get the funds directly. So,
Okay. All right. Any questions? Okay, then we'll just put that on next month's agenda then. All right, number F, Communication System Specialist Report. Is he on?
I don't believe so.
All right, number G, Code Enforcement Specialist. Brandon, you're up.
Thank you, sir. So not too much going on in October. Impounded dogs were down significantly. But a lot of the ones that we did get weren't returned to owners. They were brought over to the Humane Society. Big reason for that is what I believe to be the high number of surrenders where someone has a dog they no longer want, and they call me up and claim that, oh, well, the dog just showed up. And I base that off of the fact that Eau Claire also is seeing a lot of surrenders within the last 2 months. And then the fact that every time I've had those cases, it's been first, well, the dog showed up a week ago, and then the story would change 3 times before I finally got it. And so that's difficult because it's hard to actually prove it,
Mhm.
you know, if someone owns a dog or not. But thankfully, all the ones we did get have been very cooperative and easy to get over to the Humane Society. So there.
Is there anything that, say, if you did find out that somebody had surrendered a dog, is there any repercussions, or they just, oh, well?
Well, we don't take surrenders, and I try whenever someone calls me up and says that, gives me a story that sounds fishy to me, I try to remind them that if you want to surrender a dog, if you own this dog, you have to go through the Humane Society. And it's not really a lengthy process for them. They just need to fill out a form, and as long as Humane Society has the space, they will take the dog. I think that most people just don't want to go through that, and they figure it's easier to call me and lie. And say,
Yeah.
you know, just come get this dog. It showed up a week ago. And that's the one common thread I've noticed every time it's a surrender that I suspect. It's been the dog showed up a week ago.
You just now call.
So, other than that, license and overall revenue down for October. Obviously, the licenses, we're moving to 2023 next month.
Mhm.
I think the 15th of December is when we start selling those. And then with less impounds and more dogs not returning to home, we're not getting any revenue from holding those dogs. You're just getting sent over to NHS. Right now, I'm trying to figure out a cutoff date for those licenses. For example, I had someone come in yesterday and buy a license for 2022. And well, now next month you need to come and buy another one. I think that Price County cuts theirs off in sometime in mid-October, if I'm correct. But that's the next thing we're looking at to kind of alleviate that, because we're not seeing much revenue from it anyways.
Okay.
And then work with public health and zoning continues. I'm doing a lot more site visits. Last week went out with public health to an address, and I know they're following up with that again today. And then relevant reports all below. That's about
Okay.
it for this month.
Yeah, go ahead, Sheriff.
Mr. Chairman, I'd also add that the Village of Radisson October meeting. Brennan and I went down and gave a presentation on code enforcement with their village ordinances and explained the difference. And a lot of their ordinances, the county has a parallel ordinance that he has the authority to enforce. And explained and presented to them how we do not have the authority to enforce their village ordinances. And the same with towns. And there is a process that they can pursue to achieve and acquire that. But the county is unable to at the sheriff's level or the code enforcement officer's level. So I think that was pretty well received, and Brandon has been very well received in talking to quite a few municipalities that I've communicated with, so.
Okay. All right. Any more questions for Brandon? Yep. Thank you. Doing a good job, Brandon. Appreciate it. I really like your report here.
Thank you, thank you.
Okay, number E, no, I'm in the wrong spot here, excuse me. Number 12, Child Support Department report. Anybody on for that?
I think Sandy might be on.
Sandy, are you on there?
Yes, and I did a written report that you should have.
Yep, I got it in front of me. Do you guys have any questions for Sandy on her report? Okay, thank you, Sandy. Nobody has any questions. Thank you.
All right, thank you.
All right, number B, child support MOU with DCF and LCO.
So this will have to go to next month's agenda as well. We have had, this is MOU regarding the transfer of child support cases from our agency over to LCO. The MOU hadn't been updated in quite a few years. The discussion, just recapping it, was because LCO updated their ordinance relating to child support enforcement. And so it necessitated updating the MOU. So we had asked for some things in the course of updating the MOU that we've worked through. We've had a series of meetings with this DCF and both sides of the MOU. I think we've got everything mostly agreed to in principle. There'll be it has to do with how the court transfers the cases, and then when they transfer, some of the cases transfer money's owed to the county yet, whether they be filing fees, service fees, the children were in foster care at the county, and then once they're transferred to LCO, they take over operating the case. We hope they can collect on our debts. They have difficulty collecting just like we would. So we just ask for an opportunity when their time period ends of when they're collecting on these cases that we be notified. So if we want to pursue any of those debts, we can. And at this point, where the agreement is, it's between the two attorneys. We're just sorting out the language. Agreed to what we want to do.
Okay,
It's a matter of them putting the language together that bring the MOU back to us.
okay, so you wanna postpone it until next month's meeting?
Yep.
I guess I should be asking, do we need a motion from this committee to do that? Or can we just say?
No action taken at this time and move to December meeting?
Yeah, what was your question?
Well, I'm asking, we didn't do it on the other one that we tabled either, but I'm asking, do we need a motion from this committee to postpone it until the next committee meeting?
Yeah, I mean, that should be the chair can either direct, there's no action and direct it to be on the agenda.
Yep, that's what I'm doing now. Okay. All right. Yep, that's fine. Okay.
For me?
Yep. All right. Any questions on that, anybody? All right, number 13, coroner's report. Mr. Fremmel, you on there?
I am on. Can you hear me?
Yeah, we hear you.
Awesome. Well, obviously you can see that I got a pretty long report. I didn't focus too much on the coroner stuff because I had a lot of other stuff going on. So that the top is just a brief overview of what I did for the last month. Do you got any questions on the actual coroner's report?
I have none. Okay, nobody else either. Okay. There's no questions. We'll move on to number 14, Mr. Prem.
All right, and that's been the busiest, obviously, because that is my new role. I've kind of taken over that. And so I came in at a wonderful time when a lot of things are due. So right now I'm actually doing, the reason I'm not there is I'm actually in a class right now for the WEM, Wisconsin Emergency Management through the state. But we've been doing a lot of training. I've been pushing my people here for the ambulance to get out, reach out to the communities, see who needs CPR training, AED trainings. We're updating their pads, making sure all the pads are up to date. And anybody who needs like either refreshers or if they want CPR cards, I'm having them reach out to us. Jim Onerheim has been instrumental in doing a lot of the classes for me, but also has Diane Weimer and Leah Zessinger, all EMTs for me. We are planning on some more training and during some of our monthly meetings, which are coming up, we're going to be doing some refreshers, and some of our teachers or my instructors are going to also bring up a plan for education for the community. We have reached out to the Hayward High School, the LCO College, and a couple other things about starting a EMT class in the actual high school. And, you know, working with either Northwest Tech or LCO to get that going. So that's in the talks right now. And what else? Yeah, we've just been busy. I mean, keeping up on the billing and keeping up on the runs. We've been able to keep up on everything. I haven't focused too much on transfers because, yeah, we are still short people. But I think we've been doing good covering our 911s so far. So any questions on that?
Yeah, how many people are you short yet?
I could use 2 full-time paramedics. We did get 3 part-time paramedics in. And I'm looking for 1 or 2 more advances. So we're not actually down EMTs per se. We just need a couple more real paramedic, full-timers, but the part-timers have been stepping up. And then whenever possible, I've been just replacing, giving overtime because we have to have coverage, so.
Okay. Any questions for Mr. Kreml? Go ahead, Mr. Peters.
I'd like to thank you for having, I see the diversity of places where you're having the CPR training. But it does seem that, are there any possibilities for getting that type of training either down south farther in Exland or over in the winter, Loretta Draper area?
Oh, yeah, we just reach out, and I reach out to everybody like the fire associations and stuff like that. And whenever I get a request, we set in, obviously we don't want to really do a one-on-one. We'd like a small group, at least about 5 to 15 people. But whoever reaches out to us, that I try to we set up a time. I set up an instructor and we just do it. I bought brand new brand new CPR stuff. We have brand new trainer AEDs that were paid for by the Walmart grant that we received. Thanks to Mark Gritzmacher. He reached out to Walmart and he gave us a grant that I had to pay for it, but then the grant reimbursed what I paid for. So that was really nice.
Okay. Pass this information along to the townships in the southeastern part of the county because I'd like to know that there'd be someone down there that could do it for me if I need it. So.
Well, and Leah is actually from Exland, so she's one of my instructors, and she's down there, so I can always set up times with her. We just went through the AED for winter fire, I believe, and we gave them, we made sure their AED was up to snuff. So
Okay.
Yeah, I don't care where, but we'll do whatever, whenever. So whatever works for everybody, because if we can get people to recognize, cardiac arrest, it ups our save rate, which is good not only for the patient, but for, the community in general.
Yeah, so if you need someplace to hold them in the Exxon area, I'll offer our township town hall to you guys in the town of Meadowbrook.
Beautiful, we'll definitely use that, and like I said, if an organization or township wants to put a class together, just reach out to me. I'd like to say that I'll reach out to them, but right now I got so many classes going on, it's just easier for me to answer an email and set something up than to do it, if that makes sense.
Okay. All right, any more questions? All right, number 8, appointment of management / ambulance director. Andy, you want to give us an update on this?
Yeah.
I know what it is, but
Yep, so I'll be forwarding, I think this makes sense to start this committee, but we did do a hiring process for Nate Dunson's replacement, which John has been doing on an interim basis. We did, Mr. Buckholz, the sheriff and I did interviews with a few candidates, and I'll be forwarding to the county board appointment of John Fremmel as taking the interim tag off and having him be our new emergency management ambulance director.
okay. And you need a motion from this committee to send it on to the county board.
Yep.
Okay,
I move the appointment of Mr. Bowman.
second,
Motion.
any more discussion on that? Lynn, you want us to use these things?
Yeah, we're gonna try something new here,
Okay,
but we're gonna give you a chance to test it.
okay,
So Andy, you're gonna be Jason Weaver this time,
Okay.
and I've got a test question up here
okay.
that we're gonna use first. I'm gonna tell you what it says.
Oh,
And so this question you're gonna answer yes or no. Is the zombie apocalypse an official prevention measure found on the US Centers for Disease Control? When I tell you, you can vote yes or no or abstain.
read that again.
Is the zombie apocalypse an official prevention measure found on the US Centers for Disease Control, the CDC reports? So you can vote now. Okay, we have our votes in. We have 4 out of the 5. I'm gonna close the vote. And Mark Helwig is the only correct person. Yes, it is. An official prevention. measure.
stupid enough to be.
Well, okay,
So that was our test.
Well,
question.
that-
You know how it works.
Yeah.
Okay, so now I'm going to go out of it and we're going to go to the appointment of emergency management. And I'm going to, now Andy doesn't get to vote, of
Right.
course. So I'm gonna open up the vote now and the 3 of you can vote. We have all 3 in, so I'm gonna close the vote. And the motion passed, 3
to send it on to county
So
board.
now,
so now it goes to county board.
if those guys were on virtually.
Well, before I would close it, I would ask for their vote. So you guys would all vote for,
Vote with this and then.
and then I would ask them to
Okay.
vote virtually and I'd hold their clicker and put it in.
Okay. All right,
Okay, so now I'm gonna stop sharing my screen. I gotta figure out how to do that. Stop share. So my part is a little bit more cumbersome, but yours is just fine.
okay. All right,
Okay, so that was the motion by Ed and second by
Mark.
Mark. Awesome.
okay, number 15. You got something saying?
Yeah, I was gonna stick on 14 for a minute, so. So the last month, John and I have had quite a few conversations. We also had a meeting with the sheriff and Julie from Public Health, just to help out getting him going on emergency government. But we've also talked about, obviously, right now, John is the coroner. He'll be the coroner until January, then we'll transition to the medical examiner. So kind of where we're headed, just to give you a heads up, is talking about, I mean, he can't do all 3 jobs, so we'll be appointing a medical examiner, but obviously he's got a lot of background there. And since all but one of our current, John, as well as the deputy, I mean, he's all but one are part of our ambulance service. I'm moving in the direction of trying to merge those together a little bit more, so that part of their job duties as paramedics or EMTs will actually be deputy medical examiners. I think there's some scheduling benefit as well as maybe some financial benefit to do that. So where we'll end up is with like a emergency services department that encompasses ambulance, emergency management, and medical examiner. That's kind of where we're headed. He's already done some, I don't want to say experimenting, but kind of, he's had a couple medical examiner calls come in while people are on duty, so they switch from being a paramedic and they send them out to be a medical examiner, just seeing how that would work. So that's kind of the direction we're going, and yeah, it's kind of a work in progress.
Right. Okay. Number 15, Criminal Justice Coordinating Council update.
Really focused in on two things right now. The drug treatment and diversion court program. So our diversion program is up and running through the TAD grant that funded that. The application deadline for 23 was due yesterday. We already done a tenant or a pre-application where they indicated we'd be funded for up to 300,000. So that'll fully staff up everything for the diversion and treatment court. So to do that, though, we had to essentially get all the planning work done for the treatment court part of it. So that'll be ready to go first of the year. Assuming that the grant comes in, justice contract with Justice Point will expand for a couple more individuals to handle all that work. And the other part of CJCC is still discussing how to address the opioid issue and utilize the opioid funds.
You just said that they're expanding. How long is these funds going to keep that program going? 300,000
Yep.
doesn't last very long with all
300,000 will be a year-to-year grant. The TAD grants, my knowledge of it is that initially they told the programs when they were being funded with TAD grants that they would fund them 3 years. Then they should look at how to sustain that program in these counties beyond 3 years. But as far as I know, no program that got funding 3 years ago, more than 3 years ago, has lost grant funding at this point. So it's still operating. As long as the state keeps funding the grant program, I think we'll be able to get the grant funds. That's why I think from the start, we're trying to build in some metrics, some measurements to see if it's successful or not. So if we get to the point where we have to look at county taking on more of the funding, we'll know if it's worthwhile or not. Even with the 300,000, we're funding $75,000 in matching funds to get the 300. And so we're achieving that through our contract with Justice Point. We already had a contract with Justice Point to do the pretrial work. So between that money and then also the office space we provide them, that's how we come up with the match dollars. And something we talked about in a different meeting. So because Justice Point right now is on the other side is here, they share one just little cube for 3 people. They're going to 5 people. So looking at moving them to a different office area, which will help some other people's.
But you would have the authority to move people.
Yeah. Apparently. I'm not sure if that's.
A good thing
a
or
good
bad
thing or
thing.
bad thing.
I know we're still gonna be talking about that. Public works.
So yeah, slowly working that around, and I think it'll work out. So that's where we're at with CJCC. And I think the other thing with CJCC too is discussion has been about expanding the CJCC committee. So right now there's proposal to add 2 people, one from Human Services and I can't remember the other one's coming from. There's 2 people to add to the kind of the membership, but we've also essentially directed like human
LCO?
they're already on there.
I wonder if it's just the replacement of the chair position, because we're short one there.
Yeah, I can't remember, but I know where we are directing some staff to come to CJCC. Part of that is there's been very little involvement from Human Services on CJCC, so we've asked them to supply us with somebody from the juvenile justice area as well as the mental health area. So that kind of means.
Any more questions, Randy, on that?
Thank you very much.
All right, number 16, courthouse fees update for 2023 budget.
I asked this to be put on all the committee agendas this month. It was part of the budget presentation at the county board, but just in case department, or the committees were not aware of the charges within the departments that they oversee. If you had any questions, we could go through them. I know like for these committees, there was the sheriff had an update to one of his fees. I believe that was the booking fee. Somewhere.
Okay.
Let me just drop down here. One's not under.
Went from 20 to 25.
Yeah. Yeah, it went up from 20 to 25. Then Brandon reviewed the fees for the
licensing.
yeah, we call it the dog pound.
The kennel.
Change that
Kennel.
to wording someday, but just the charges for spay and neuter is being changed, as well as the kennel boarding fee that we charge for animals we have in.
Mhm.
So we kind of, I guess, looking at back, this document gets adopted with the budget, just to kind of address any changes, make things sure things are current. But I think we'll be looking at some of these, maybe, we don't have to change them all now. Like I talked to John about the corner area where our by statute, those fees have been frozen, but we are able to pass a resolution to adjust them annually by CPI, Consumer Price Index. So I think we might move ahead with that just to get those moving in a positive direction. So that'll happen after this is adopted.
Will that title for that section change to medical examiner then?
Yeah, corner will change the medical examiner. And the statutes or the state statutes that apply to that area are interchangeable. It covers corners and medical examiners. And otherwise, it's just on there for reference. It'll be part of the budget approvals at this month's county board meeting.
Any more questions on this? Very interesting, Andy. Okay. All right. Not move on to number 17, future agenda item.
Got two already.
2 already, yep, okay. If not, number 18, correspondence reports from other conferences and meetings. Okay. Not, I just want to say one thing before we close. I want to thank the sheriff and chief deputy and the lieutenant. Are you a lieutenant now or are you still a sergeant? Okay, so he's a lieutenant and I want to thank you guys for all you do and all your deputies for filling in where needed. I know it's rough and I'm hoping we can get this worked out. Thank you guys. Appreciate it.
Thank you.
Okay, if there's nothing else, we're closed.